Our mission at Merck MSD is to discover and develop products that save and improve human lives around the world. And my visit here has underscored how important our mission is and how important it is for each person at Merck to take that mission very seriously.
We have a long history of helping in this kind of way with our MECDESAM program, with our programs in AIDS, with our patient assistance program, and this is the next level that we've arrived at. The problem of maternal mortality is a great challenge and one where we feel that we can contribute working with others.
Every woman and every child matters. And in a world where we have access to so much in the developed world, it's not acceptable for women in the developing world to go without the most basic services.
I just visited a ward where I saw 75 women in late stages of cervical cancer. And it made me realize how important a product like Gardasil can be, because we can now prevent most cervical cancers.
We've been able recently to roll out a plan for Africa. It consists of two principal dimensions. One is simply to roll out our product portfolio, and two is to create more access in more countries in Africa.
There is so much that we can do. We can have such an impact, I believe, in a relatively short amount of time, and literally save women's lives.
The birth rates in this part of Africa are amongst the highest in the world. The average woman delivers 7 babies during her lifetime. About 80 to 85% of the births are actually in the countryside.
And that's why a drug like Implanon, which is easy to administer to women and is a long-acting contraceptive, is important in contexts like this.
In this country, fewer than half the women have access to family planning.
Uganda has one of the highest rates of maternal mortality in the world, and that's why we're here.
When a mother bleeds to death, the nation bleeds to death, the community bleeds to death, everyone suffers. And if we can't take care of our mothers giving life, then actually we've achieved nothing.
You know, every time a woman anywhere in the world becomes pregnant and will deliver a child, she puts herself at some risk in order to give life. But in places like Uganda, the risks are so much higher.
If a woman does not survive her pregnancy, not only is there often an infant without a mother, but there's the family without a primary caretaker. The children in the family are left to fend for themselves. They lack access to education. They don't have health care that they need to get a good start in life.
We went to an outpost in Ethiopia and had an opportunity to see what it's like to have one person that covers a population of 5,000 people, and to see how she cares for people with very, very limited infrastructure and very, very limited facilities.
One of the most moving experiences in this hospital visit was to sit at the bedside of new mothers. Most of these mothers are very young, and we have an opportunity here to ensure that these women can deliver babies safely, have healthy lives, and raise their children to have healthy, productive, vibrant lives. We can do nothing more important than this.
Merck has really tackled some very, very tough healthcare issues, such as river blindness, such as HIV, such as cervical cancer, and now Merck for Mothers and maternal mortality.
We need to understand that when we come to work every single day, the work that we do can have a huge impact.